Thank you, everyone, for coming. I'd like to make a special thank you again to the students here from the Stanford Review and the Stanford Conservative Society, and of course the Hoover Institution for putting on this event. Our guest speaker today is Dr. Scott Atlas. He is a senior fellow here at the Hoover Institute, and he's also the chief of neuroradiology at the Stanford Medical Center, as well as a senior fellow at the Freeman Spogli Institute. And if you guys can see where we're leading, we're going to talk about healthcare today. So, Dr. Atlas, thank you for coming.
Okay, thank you for inviting me to speak. And I thought there maybe, being at the Conservative Society of Stanford, I thought maybe there'd be one or two people in the room. So I'm overwhelmed by the response. Okay, so what I'm going to do is go through some of the big issues in healthcare and hopefully clarify what I would call misinformation that's been put out there repeatedly by intelligent and educated people. But despite that, there's been a significant distortion, I would say, of the facts. And as I'm sure all of the Stanford students understand, the strongest arguments are really based on fact. And it's critical to understand what's going on in U.S. healthcare today, as well as then the solutions for the widely acknowledged problems. Now, there is a fascinating disconnect that surveys show repeatedly amongst Americans. On one hand, the vast majority of Americans are satisfied or highly satisfied with the quality of their own health care. And this number has been rising steadily over several years. And I have several references on these slides, which you're welcome to email me about if you cannot find them. Interestingly, almost the identical majority of Americans say the healthcare system needs fundamental change or complete rebuilding. And I think that the question of why people would say that when they have no personal experience with that, I think raises the issue that I believe is a fundamental flaw in the discussion about healthcare, and that is that there is information being perpetrated upon the public that is not fact-based, yet makes a strong emotional-based opinion being formed. There is a general consensus on big problems in the United States healthcare. There's no question that the costs are high, they're increasing, and the cost to the government in these programs is absolutely unsustainable, and no one disputes that. There are also millions of people that are uninsured, which, by the way, is not synonymous with not having access to health care. That's one of the biggest distortions and misconceptions, actually. And those of us in the medical system understand this quite well, or should, that you are not denied care, no matter what you see in the Michael Moore movie, when you don't have insurance and you show up to the emergency room. You get the full court press, you get angioplasty, MRI, every other expensive technology. There are problems with not having insurance, and those do relate and are more nuanced, actually, issues. They relate to outcomes and absence of preventive care and these kinds of things. The third issue is health insurance is not portable. And by portable, we mean something unique to the American system. Because in the United States, as opposed to other countries, people move. People change jobs frequently, move coast to coast. This is not the case in Western European or other parts of the world. And so this is a big problem. And it's simply tied to being employed. In general, if you're not employed, you don't have health insurance. And that's a big problem. And all these things make the dissatisfaction with the system specifically high. And that means patients, doctors, employers, everybody. Now, what is receiving attention as what the big problem is that the spending on health care is extremely high, the highest in the United States compared to other countries. And people are continually saying, well, we're not getting our money's worth because we're unhappy with the healthcare system and the system does not have better results. Yet we're spending so much. And this not getting bang for the buck, as has been said, is really referenced, the singular reference of this opinion is something called the World Health Report that was issued in the year 2000 by the World Health Organization, WHO, where they tried to rank the world's healthcare systems. And they included 191 nations, as you can see, with a basic ranking system that was determined by the authors to be 5 factors: health level, health distribution, responsiveness of the system, the distribution of responsiveness, and the financial fairness. And these things were assigned a weight. And I think you can tell by the titles of the factors that they used that there is a tremendous amount of subjectivity in this ranking system. But in that ranking system, you see the United States down there behind a variety of developed and undeveloped nations that I think would shock you if you could actually read the print on the slide. Now, what are the problems with the WHO data? And this is something that is totally underplayed, if played at all, in the media that most people read. This study has been completely in disrepute in the academic data that is analyzed, in the academic journals that has analyzed the data repeatedly. And we see some of the references on the right here, and this is just one tip of the iceberg. Not only are the data subjective, the data were missing and filled in arbitrarily by the authors on numerous countries. The inputs are not even related to health system quality in many cases. There were assumptions made about the weighting and the distribution and prioritization of the weighting of each of those 5 factors that are completely arbitrary. And lastly, if anyone here has ever looked at a scientific study with quantitative data, the errors in measurement were huge. And when you look closely here, these bars are the error bars. And the data is not statistically significant in the difference for almost any of the countries that were rated in the table. So none of this information about the quality of that ranking system has really been talked about much in the media. Now, there are other issues. Specifically, the 2 factors that people talk about in terms of ranking are life expectancy and infant mortality, which at best are extremely crude measures of a medical care system. But it's even worse than that. When we look at the data where the U.S. ranks 42nd in the world on life expectancy, yet having the most expensive system in the world. Well, a paper was recently published that took the OECD nations with the data for life expectancy, and we see that in these highly developed countries, the U.S. is near the bottom, second from the bottom. And then when you look at the data and delete the immediate death from murder and head trauma in a car accident, which obviously has nothing to do with your healthcare system if you're dead immediately upon impact or from murder, immediate death. The United States has the highest life expectancy in the world. And, you know, this is a rough-read publication, and there's just an incredible lack of scientific analysis of the data, yet this is the data that we're dealing with. Now, I was raised by somebody who taught me in a sarcastic way. My father's comment was, "My mind's made up, don't confuse me with the facts." And that actually is what's happening here. The reality is that American healthcare, medical care, is actually superior. The uninsured population size is grossly exaggerated, and public plans, government plans, are already unsustainable. So the logic of pushing everyone into that sort of plan or expanding dramatically public health care is kind of lost on me. Now, why would I say American health care is superior? Well, it's all in the data. The United States has the best survivals from cancer and almost all other serious diseases. The United States has the best access to screening, the best access to new drugs for serious disorders, the best access to safer, more accurate diagnostic technology, the quickest access to surgeries, whether or not they are increased with increased survival. There are many things like hip replacements or cataract surgery that completely change your quality of life. We have the fastest access to specialty trained doctors in the world. And this is based on data. These are studies that have been published that talk about wait times. Best access to treatment for chronic diseases outside of cancer. And the source of the world's leading innovations in medicine by any metric that has been devised. Here's some of those studies. The 5-year cancer survival rates from all the common cancers. United States compared to Western Europe only. The countries held up as having the model that we are trying to emulate here. There are statistically significant differences in almost all 5-year survival rates. And on the right is, people would say, well, but that depends on how many people are diagnosed, et cetera. And there are ways that cancer survival rates can be argued. So then we look at a study that was done to eliminate those biases and just talk about in a very common cancer, prostate cancer, where there is known screening that has been employed widely for years. When you look at the recent data over several years that talks about the death rates, are they going down or up, meaning the success of medical care. The death rates in the United States are statistically significantly better than the average for all of those other Western European countries. What about drug approvals? Access. This is all about access. The average delay to get marketing approval of new drugs. This is Canada versus the U.S. A significant difference, much shorter delays in the United States. What about minimally invasive treatments? Many of you may not realize, but the way medical care is going now, it's all about safer. The innovation is all about safer and less invasive, less complications for diagnosis and treatment. And we can see that the use of, in the United States, compared to all the Western European countries and Japan, as well as Canada, there's a significant increased access to newer minimally invasive treatments. I talked about innovation. No, it's hard to assess innovation and the effect of innovation, so it's done in a variety of ways. One way is the launch of new cancer drugs, which of course is a huge significance. When we look at the last decade or so, the first launch of new cancer drugs, the United States dominates other highly developed countries. There's no comparison. What about the list of the most important recent medical innovations? Where do we get this list? This list is gleaned from a report by the leading doctors of the world. And we can see that the vast majority of the 10 most important medical innovations are shared or came solely out of the United States. This is the system that drives the world's medical innovations. What about the uninsured? We've heard much about 15% of the people, or between 45 and 46 million people uninsured in the United States, referred to as scandalous in papers like the Financial Times and all over the European newspapers. Well, here's some facts. If you take the 46 million people that are uninsured, 10 million of those people are not U.S. citizens. Now, that's arguable how important that is, but that's not necessarily going to be included in any health care reform anyway. 10 million are non-citizens. 15 million of the adults in the uninsured figure are already insured, fully eligible. It's simply that they haven't signed the paper because they have not accessed the system. They are already insured by Medicaid and Medicare as it exists right now. So if they walked in to anywhere, medical clinic, and they just signed the paper, they're in. So they actually have insurance. They haven't simply used it. 6 million children in that 46 million are already eligible for current government programs. Same kind of thing. They just have not accessed it. So there's no reason to change anything if you're trying to improve access for them. So in the end, there are 14 million Americans who are uninsured, which is not zero, but it's less than 5% of people. So when you're going to talk about dramatic changes to the entire system because of the significant percentage of people who are uninsured, you have to understand what percentage of people are actually uninsured. In that 14 million, 9 million are in families earning over $66,000 a year. And what does that tell me? It does not tell me that they have enough money and should be forced to buy insurance. What that tells me is they're making a decision that insurance is not a good value for their money. So if you want to make the system better and get these people insured, my opinion is that insurance should be made a more attractive value for these people. They're making a decision on what to spend their money on and what not to spend their money on. What about the argument of increasing the people who are in public plans, which is a significant part of all the Democrat plans on the table? Well, I think everybody knows this kind of scenario here, that the spending on healthcare already is markedly higher than inflation or on anything else. And the projections are even higher than what I show here. This is a slide from, I think, 2006. The share of GDP is projected to massively increase on health spending. And when you look specifically at projections out to 2082 for Medicare and Medicaid alone, in the current configuration, not in an expanded configuration, it is unsustainable. So the rationale, the logic behind increasing the role and the number of people in an unsustainable program already is arguable at best. And we can see that this applies to both inpatient and outpatient, is that the projections are that these programs in current level usage are going bankrupt within the next 10 years. Those are the bottom lines. Now, it's one thing to say the current plans are no good, they're flawed, the logic is bad. It's another thing to say what reforms should be undertaken. And that is really critical. And it's important to understand, as I have pointed out repeatedly to people who are highly educated on campus and elsewhere, who have never heard of an alternative plan, despite the fact that there are several bills have been proposed by the opposition for significant health reforms. The goal, what goals should be in mind? Well, my opinion is the goal of healthcare reform is to increase the opportunity for good health for Americans and their families. And there are ways to do this. One is to reduce the number of uninsured, because it is shown that people with insurance get better access to care because of they go earlier and they get more preventive care and things like that. Their outcomes are slightly worse without insurance. There should be a way to facilitate access to affordable health insurance. There should be a way to make health insurance more portable, and innovation should not just be protected in the healthcare system, but it should be promoted. These, I think, reforms are obvious. Now, I'm going to briefly review what plans we know about that are being discussed, because the current stuff that's being written is written behind closed doors, and no one has those exact plans that are being talked about right now. But I'm going to talk about briefly the Senate and Senate and House plans. The public option is a key tenet of most Democrat plans. Now, what is the point about why is that bad, the public option? Because the fact is that public option reduces the choice of insurance. And there's a phenomenon called crowd out, which has been well documented, that 60 to 75% of people who end up going onto the public option come out of private insurance already, they already have. And what happens is that the more that happens, which has been documented to occur even in the United States. For instance, in Hawaii, where they instituted a government plan to insure all children, the plan went bankrupt because 70% or 80%, depending on what article you read, of people who took the option already had insurance. They were in private insurance. They went into the public insurance option because there are certain advantages that can be configured when the government runs the plan, in price-wise, and it started to put out of business the private insurers, and the program went broke, and they disbanded it. It also raises costs, because when you shift people out of their private insurance, you're shifting them onto the dole of the taxpayer. And so that's a huge problem. The other problems is that when the government plan dominates with a public option, the position of the government insurer is they will dictate what insurance covers. This is a fact. It's in the bills. And that means things like not just getting the appropriate care, but dictating what is appropriate care. restricting access to technology, to cancer drugs, specialty physicians. These are all in the bills. And ultimately, that is synonymous with a word that is a very harsh word, but that is rationing. Because the fact of the matter is that if the government wants to force down the cost of health care, there is only one way to force it down, and that is to restrict its use. There is only one way that health care can be forced down. If you don't want to use market forces, if you want to force it down, it's to restrict use. Or indirectly, to restrict what you will pay for that health care and therefore restrict use. That's what rationing, that's what people mean by rationing. Now, the Baucus plan, this is the Senate plan. These are the specific quotes from the CBO article on these, but this is basically the 4 parts of the plan. There are significant penalties on health plans deemed excessive. Who deems them excessive? Government bureaucrats is going to say what plans are excessive. And you're going to pay a tax. Well, what kind of tax? Well, 40% tax. Significant Medicare cuts. This is in the bill. Rates are going to be reduced by about 25%. This is payment rates for medical care. And what happens when you do that? You can't make up for loss by increasing volume. And if you're losing money per procedure, you're not going to do the procedure. There's a federal health insurance exchange, which directly or indirectly subsidizes the insurance plan that meets the government definitions. And what happens is that the people who were told repeatedly by the president that you will not lose your health insurance if you currently have it, that's simply incorrect. That is a false statement. Because when employers, right now, 60-some% of employers only offer one plan. 90-some% offer only 2 plans. I happen to be lucky and work at Stanford where there are several plans. But 90-some% offer only 2 plans. If they're going to be penalized by not offering the plan of the health insurance exchange that is approved, they're not going to offer those other plans. So that's just simply incorrect that people will be able to keep their insurance they own. The last thing is that there is a penalty on medical innovation in the Senate bill. And that's a fact, that there are significant taxes on manufacturers of medical equipment, medical device, and drug makers. Now, just what are some of the opinions on some of these ideas that are the crux of what is being discussed by the president and Democrats? Individual mandate. Okay, how do Americans feel about having a mandate that you must buy insurance? Well, it says here that 66% of people ask that question, that's okay. And this is a study by Kaiser, by the way. Now, when these people were asked, what if you heard that this could mean that some people would be required to buy health insurance that they find too expensive or simply did not want, which is what a mandate obviously does by definition. 73% of Americans oppose an individual mandate. What about taxing these so-called Cadillac plans? This is the phrase that's been used. Would you favor or oppose having health insurance companies pay a tax for offering very expensive policies? That's on the table here being discussed. 55% say yes, those companies should be paying a tax because these companies have been demonized. Supporters of the question were then asked, what if you heard that that tax might be passed on in costs to the consumer, which of course is exactly what happens with everything that a business is taxed on. That's the way you work up a business plan for your product. 69% of Americans oppose taxing health insurance companies. Employer mandate. Would you favor or oppose what's on the table, which is requiring employers to offer health insurance, and if they don't, they're going to pay money into a government fund to cover those people? And now what we hear yesterday, I think I heard, is that this means including for temporary workers, part-time workers. Okay, 69% favor employers being forced to offer health insurance because at the first thought you think, yes, they should offer health insurance. And then they were asked, what if you heard that paying for this might cause some employers to lay off some of their workers because they can't afford to do that? 64% of Americans oppose having an employer mandate. Now, the American people have spoken, not only in surveys, but in the most liberal of all places, in the most liberal of all elections, which was in the Massachusetts election, replacing Senator Kennedy for a Senate seat. And this is widely recognized to be specifically a repudiation of not just the big government policies that are currently in play, but specifically health care. Before I finish, what are the other reforms that should be talked about specifically? Because it's often said that these people, the Republicans, are just blocking things, they're being uncooperative, they have no ideas. This was said many times when the president convened the joint session and he gave the speech a few months ago about where are your ideas? There are no other ideas. That's a quote. These bills have been on the table. I have just one small voice in many, many people writing pieces on this. These are suggestions that would reduce artificial barriers to competition, empower Americans with control of the money and information, and maintain the excellence of Americans' health care. Strip back mandates. There are over 2,000 government mandates on what must be covered in health insurance. Things like massage therapy, acupuncture, chiropractors, wigs. Most people probably do not want all of those things in their health insurance. In vitro fertilization, okay? I don't think that many 60-year-olds necessarily are going to use these products. Why do they have to buy that? Because it's mandated by the government. And it is estimated that the 2,100 and some state mandates are the cause of more than 50% of the cost of health insurance right now. Yet our government wants to increase mandates. Allowing cross-state purchasing of health insurance. There is no legitimate reason in my mind why you're not allowed to buy health insurance from your neighboring state. I mean, this is not the case in any of these other goods and services that we use in the United States. Yet that sets up a monopoly within each state for health insurance. The vast majority of states have 3 or less health insurance companies. Tax reforms. Instead of having the current system which encourages people to spend more of their money on health care, because if your dollar goes further by having it deductible on health insurance, that is, for anyone who's an econ major, a way to encourage more money being spent on that good. There are other ways to have people get more affordable, have more cash to buy health insurance, like either vouchers or tax credits or others. Increasing access to cheaper insurance that people actually want, like high deductible health plans with health savings accounts, which are cheaper because they have a very high deductibility. The way health insurance works nowadays, it would be like having homeowners insurance that pays every time you need a new light bulb. Every single thing with health insurance, every single thing is covered, and you pay $20 or whatever your copay is. But many people, and an increasing percentage of Americans who have access to these programs, many people want high deductible plans that are cheaper, and then you have an associated savings account that you can own and keep in case you need the cash to pay for these lower cost items. And it turns out that the vast majority of health expenditures are small. So it also eliminates the vast majority of administrative paperwork, which is costly to the system, if you don't have to file an insurance claim for every $50 purchase. Forcing transparency on the system. This is the only good or service in the United States that you've used before you know what it costs. You get the bill from a hospital or a clinic after you have already used the service. And simple openness does increase competition. There is no question in my mind that if UCSF and Stanford were forced to publish their prices, there would be an attention to what the other guy was charging. And then fix the medical liability system. It is estimated that $80 billion or more per year are drained out of the system because of what is many people consider an out-of-control medical liability system. All of these things are being ignored, except very recently when the president, in his idea of including opposition proposals has said maybe we'll do something about the medical liability system. So there are two completely conflicting visions of health reform that have their stated goal of controlling costs and increasing coverage. The people who object to Obamacare, that I'll call it Obamacare, believe what I just said. It causes crowd out and ultimately reliance on government-based insurance, diminishes significantly the individual's control over their own very personal health decisions, forces Americans to buy insurance they don't necessarily want. It undermines state authority and innovation. It generates even more unsustainable federal spending and massive taxes. There's no question about that. Innovation for the medical system will be suffocated, and it leads ultimately to price fixing, not even ultimately in the short term, and ultimately rationing. These are the objections to it. These are the objections to a more free market model. People say it will not rapidly reduce the numbers of uninsured. There will be created a two-tiered system where the wealthy get better access than the poor. Of course, the data, which I didn't show you, shows that in Canada, which is illegal, where it's illegal to have private insurance, the difference in health care between rich and poor is bigger than the difference in the United States. And I have the references on that if you'd like. So this issue of fairness, that's one of the objections. They fear that the less regulation, for instance, freeing up interstate purchasing of health insurance, will permit fraud and inadequate consumer protection. They fear the healthy will opt out unless they're forced to buy insurance, so there won't be adequate risk pools, which there are alternatives. And they also fear costs will not come down because doctors and insurers will game the system. So final points, and then we could have questions if you'd like. My opinion, Democrats and the liberal media are distorting the message by making these claims repeatedly, despite the facts that the American healthcare system is inferior, that there's a massive problem of uninsured, and further that that problem equates with absence of access to health care. It is stated many times there are no alternatives to government-centered solutions. Repeatedly we hear the status quo is unacceptable, as if there are no other proposals on the table. Repeatedly it is said we have a great solution. It's simply too expensive right now. We're just figuring out how to fund it. I totally reject that. The solution being discussed is not a great solution. It has, even if it were free. And expanding Medicare, Medicaid is a great idea. And somehow that is not a public option. That is a claim being made by a variety of people in leadership in your elected representative government. My belief is that the opposition needs to clarify the facts and propose reforms that empower American individuals rather than the government, that increases choice and access to get people to want to buy health insurance, not to force them to buy things they don't want, and to maintain and improve what many believe is the world's best medical care and the world's best access to leading important innovations in medical care. Okay, thank you.
Great. If anyone has any questions, please raise your hand and we'll get a microphone over to you. So if anyone has any initial things they want to say. I know it's a lot of information and pretty scary. Oh, sure.
Thank you, Doctor, for that. I want to ask you a question regarding Medicare and Medicaid. You didn't particularly like the proposal that they had of, I think, cutting down by 25% the reimbursements that doctors under Medicare and Medicaid are going to receive. I guess it's slightly unrelated to the talk, but what do you propose in terms of controlling those Medicare and Medicaid expenditures that you said were going to spiral out of control?
Yeah. Well, I mean, I think this is the crux in the matter, is that the way to reduce the prices is to have the points that I've made on some of these reforms, and that is to put the money in the hands of the consumer, the patient, and to give them enough information so that they can make decisions. Now, those decisions are both about medical care and medical insurance. I don't believe, Now, let me step back. It is true that in most states, doctors, a significant percentage of doctors, are not accepting any new Medicaid patients and further any new Medicare patients because of the problems with the reimbursement. So to increase people on there, it just doesn't even make sense. The way to reduce the prices is to have people have control of the money. The reason that prices are the way they are to a great extent is because of the third-party payer system, which goes back to the nature of health insurance. Everything that you pay you think is free because you have insurance that covers even almost every dollar that you spend, almost all. And there's no reason for you to even ask, how much is that MRI? You never hear somebody ask that unless they're paying out of pocket. So one major way to do that for medical care is to have people have a vested interest in what it costs. And the way to do that is to give people the cash. And so how do we get that into an insurance thing? Well, it also goes with what you should do about getting people to shop around for insurance. And that is, I'm much more in favor of having somebody, instead of having Medicaid, give people a voucher. Let them buy private insurance. Let them shop around. When you're spending money, even if it's money that someone else gave you, you have the money, and now it's your task to spend it, as opposed to being signed into something that you don't care what it costs. And so it also goes along with the insurance purchasing as well as in medical care purchasing. You must be empowered to make value-based decisions. So people say, well, but you can't possibly make a value-based decision on medical care. It's too complicated. No one understands medicine. Well, I'm not sure how, maybe all the people in this room can explain how a computer works. But I have a hard time explaining on the very basic level how a computer works, yet I can shop around for a computer. I'm very good at shopping around for a computer. Okay? It's all about having access to information and control of the money. And so instead of increasing people on Medicare and Medicaid, I'm for decreasing and fundamentally changing those systems. For instance, having the federal government pay a certain amount for Medicaid to each state. I'd much rather have them pay money to voucherize or some other analogous way the government insurance.
Hi, I had a question about the risk pooling problem. Out of all the objections that Democrats have to a more private system, I think that might be the most valid as far as I can tell. But what were your...
Yeah, some of the alternatives to risk pooling besides mandating people buying insurance are, there are numerous, including community-based, community organization-based, as opposed to being forced to buy insurance when you have risk pooling over a certain number of people that are a wide enough array of age and health. You have pooled risk, and so there you can do that by, let's just say, multiple different church groups, multiple different not employers, but community organizations that are based on jobs and things like that. There are large pools of people that should be empowered to form a group and look at insurance that way. And this has been done in pilot projects all over the United States. This is not even a new idea. So there are alternative ways besides forcing people to buy something that they don't want. By the way, there's an interesting statistic. There is a mandated insurance for automobile liability insurance. I think everybody knows that. You must have automobile liability insurance. Okay. Even in the states with mandated liability insurance, guess what percentage of people do not have liability insurance? Between 15 and 16% of people. Almost the identical number of people, percent-wise, that have no health insurance in the United States. So amidst all of the issues about mandating things and all the enforcement issues, and what is the punishment? You're going to send somebody to jail for not buying health insurance? Or financial, or whatever penalty you come up with, there's still the fact that mandates don't even work. That's the irony of that.
So there's a big misperception, like right now, where the Obama administration is saying that a lot of the cost of health care comes from the fact that the insurance companies are just making these
Yes, and this is another, I think, kind of vilification of everyone who disagrees with the president's or the Democrats' plan. You know, it depends how you analyze that, but when you look at the profit margins of insurance companies, they're much smaller than almost any other industry. And so to say someone's making too much money, I think is first of all, a dangerous path to go down. I philosophically, that makes me uncomfortable to judge somebody and say, okay, you're making too much money. Now, in healthcare, because we all feel emotional about healthcare and feel it's a kind of fundamental, maybe it's a right, I'm not sure, that rings a truth to people. But when you look at how much money they're making, not absolute dollars, but their profit margins are actually not big at all. So there is a counter argument to that proposal. Now, one of the reasons that certain states' health insurance is very high, there's two reasons. And that has to be changed, but it's being increased by the proposals on the table. One is the mandates that I mentioned about what coverage is, which will increase with the Federal Health Insurance Exchange. That increases the cost of health insurance. But the second one is this idea of community rating, and that is that everyone must have access to insurance at the same price. This is being proposed by Obama, no matter what your health status. Well, of course, that doesn't make economic sense. You can't possibly, that just doesn't make sense philosophically or economically. And so what that necessitates is a high price on the insurance. So it's really misplacing a blame, I believe, to say that the price of insurance is based on or due to high profits. There's many reasons why the price of insurance is high, and they can be fixed without having anything to do with the amount of profit that a health insurance company makes.
We have a question from online from Jane regarding the kind of cost projections. So she said, when Medicare was passed in 1965, it was projected to cost $12 billion in 1990, and then the actual cost in 1990 was $107 billion. And so, do you feel that passing legislation like this will lead to similar kind of inflations of the cost projections and whatnot?
Absolutely. I think that is a very important point to understand. And it is a truth that has been shown time and time again. When the government controls a program, they cannot control costs. They have not been able to control costs despite all the best intentions. And this is a very good example of why I'm saying is that the logic of pursuing a failed plan by increasing its importance, there's a disconnect there. That's exactly what will happen.
I think we have time for one final question, if anyone.
So in Massachusetts, there's a public system that was set forth by Mitt Romney, who's a pretty important Republican figure. Do you think Mitt Romney's health care plan that he implemented in Massachusetts is a good one? Do you like the Massachusetts health plan?
Yeah, I think that no is the short answer. And I think that Romney himself will run away from that and did in the last election. Having been, I was running the health policy team for Mayor Giuliani, and someone else at Hoover was running the health policy team for Romney, and we had interesting discussions about this. But the fact is that the Massachusetts plan, in a state where the vast majority of people were already insured, they had a very small number of uninsured, their costs have exploded. And it's all about mandates and health insurance exchanges. So there may be some things that are good in that plan, but the result of that plan is that they're trying to grapple with the roadkill now. Because once it's been instituted, now they have exploding costs that are unsustainable, and they don't know what to do about them. And there are all kinds of new mandates and new limits on access to health care that are being contemplated, and price controls and all kinds of things. So the answer is no. I am opposed to that sort of thing. It is in many ways reminiscent of some of the things that are being proposed now.
Great. Thank you very much for coming today.
Thank you.